Now, Claudia, you work to cure trauma patients, depression, addiction. And maybe you can start by just explaining this lovely but peculiar image, which you actually, it paints really the work that you do, if I'm not mistaken.
Yes. So I think this metaphor of taking away the mask, discover the true self. And this is what we do in a professional therapy, strengthening and discovering the true self, which is beautiful. And that's why I loved this picture. I discovered it, or it found me.
So it's about taking off your mask and really getting down to what's underneath it and what's causing different emotions and different things we experience, we feel. So maybe you can give some examples of a classical patient, a client of yours. What sort of problem would they have?
Yes, classical clients we have are normally in the age range between 35 to 55. Let's take a woman successful in business, alcohol problem, mainly champagne, was for years sexually abused in her childhood by the father. The mother was too weak or maybe in a difficult psychological situation and she couldn't help. Later on in the marriage, there was a kind of repetition with a very successful husband that had other women besides, so she was in another way hurt.
Are all patients so severely hurt? Could it be a softer problem, maybe just not a great relationship in the childhood? Not so dramatic as a sexual case?
Yes, or... it can be a softer problem as well, and it depends on the sensitivity of the personality. My philosophy is whatever the client tells me that is difficult for him or her, I take it seriously and I don't compare.
And what triggers the addiction later in life, say to alcohol? What sets that off?
Often it begins in the adolescent phase. It has to do as well with the peer group, but it has to do with the basic personality as well, with the genes we bring with the family history, with what you experience in these early times, and which type of personality you are.
Are we all prone to addiction, Claudia?
No, not at all, no. There are the anxious types, the depressive types. Yeah.
And at what point is it too much, the addiction, the depression? At what point do they come to you?
Yeah, it's a good question. When you suffer. As long as you don't suffer, as long as you manage your life and you say, I'm content with my life quality, I think you don't need therapy.
Now, the therapy that you offer, it doesn't involve medication. It involves many different specialists and treatments. Maybe you can explain how those treatments start and what they look like. Does it start with a conversation?
Yes, mainly between me and the client, because at the end I need to decide whether I believe that we really can help. And there are some types of mental illness which I know we can't work without medication.
Are people beyond help then?
Yeah.
Sometimes?
Sometimes, yes. Or I say, look, we need a certain kind of medication for the stabilization, and probably you need that for your whole life.
So very severe cases would probably not be your customer base?
Yes, or certain type of mental illness, yeah? So there we are limited with our holistic approach, yeah? But for 90% of the rest, we can do without psychotropic medication.
So you have a conversation, a dialogue, you try to find the root of the problem, and then what happens?
And then normally for 1 to 3 days and nights, we have a private partner clinic, and we give the client there, we do an internistic status, and we begin with the detox when we have an addiction case. And then they come into our private residence.
And that's a course of about 4 weeks that they're in your care?
At least. Because often those people are suffering since 15 or 20 years or longer. So 4 weeks are a short time. We can reach a lot in 4 weeks, sometimes 6 to 8 weeks.
So what takes place in that period?
What, can you repeat?
What takes place other than
Yes.
the conversation? What type of treatments?
It's a very dense treatment program, and we have a schedule like in school. We have between 6 to 8 therapy hours a day. Pure psychotherapy, we have around 9 to 10 hours a week, not more. The rest is mainly in the first 2 weeks, relaxation.
So are you saying that dialogue with the client, a typical psychotherapy session, is not enough?
It's not enough. I think we cover with the psychotherapeutical part around 40% of our success. 30% maybe with the orthomolecular medicine, where we work with micronutritions, and the other 30% with alternative and complementary medicine.
So a lot is down to diet.
We do nutrition counseling, yes, we do. What we eat influences us, yes. And we do not extreme diets, not at all. So we ask people, what do you like? But when we find allergies, you should avoid them. A lot of the people want to lose weight as well. Or we find the metabolic syndrome, which is overweight and a tendency for diabetes and a risk for heart.
You said 40% of the treatment is dialogue, and 40% is, what was the word you used?
Orthomolecular medicine.
And maybe you can just define what that means.
Where we work with vitamins, minerals, and amino acids. So we measure the deficits you have, and we fill them up in a personalized way.
So you're then balancing the chemicals inside the body, the natural chemicals, as opposed to hard drugs.
Exactly.
And are you totally opposed in your work to the harder drugs, the antidepressants, the different drugs that are available to try and balance out ill feeling, let's call it?
When people are coming with this kind of medication, normally they come with a combination of 2 to 3 medications. We try to fade them out. You can't stop them immediately, because then you find a kind of withdrawal syndromes. So we need to go out slowly. And for that, normally we need 10 to 14 days. And then we need to see what is without medication. How do you feel? What comes out? What can we see?
What is success for you, Claudia?
When I can help someone.
And is it a case of helping them for the next month or 6 months?
No.
How do you know it's for the longer term?
You need a follow-up, and this is the best. And when we can do that, this is very thankful. So a contact after 3 months, after 6 months, then maybe after 1 year. Sometimes the clients come back because they say, the problem last year is solved, but I want to work on this issue now. But normally the stay should be only once in a life, or when you have a relapse, you should come back as soon as possible.
And some of the problems that your clients encounter, they may not always be problems, maybe something at work that is easily fixed. So what's then the advice and the recommendation? Do they have to leave their industry, their job, their work? Or can they find some sort of peace with it through your therapies and find harmony in the workplace, for example?
Yes, there are both ways possible, I think. And what we do in the widest sense is resource activation. What means for me, we activate everything what brings you positive feelings. That you discover not only a hobby, but a passion in your life that brings you energy back.
Some people don't know what that is. How do you
you
unlock
are right.
it?
Some of the people are empty and or really never did the experience of what they like. They don't know what they like. They don't know who they are. That's why we need to discover it. And then I suggest you need to try out. So certain things you have yet the possibility to know in our treatment program, as meditation or yoga or certain kind of sport and personal training, or working with horses, or working with the voice therapy. And it would be great when you love some of those techniques that you can transfer them into your daily life, and you should continue with a regularity to have them.
Now, it's probably not cheap to attend such a course, so I'm assuming that a lot of your clients are in powerful positions, wealthy individuals.
Yes.
What's your assessment with that, I don't want to say group of people, but say the wealthier end of society? Are there trends, are there patterns that you spot in holding such a high-powered job or having a lot of wealth?
For me, there is no difference. I work with a human being, and I think this is the most important point. Whether this is a European king, yeah, or this is a high successful businesswoman, I work with the emotions. And I'm not really interested in the title, and I think this is what those people need.
And in terms of male, females, what percentage of each do you get through the door?
We have around 70% women and 30% men.
And why is that, do you think?
I think because I'm a trauma specialist, because we focus on that and we find trauma in a lot of other diagnoses. And borderline personality disorder, eating disorder, you mainly find in women.
And does every case have some sort of trauma back in their life when you track it back? Or it's just they've suddenly come into a trauma?
Yeah, not every case has it. And even not each person that experienced trauma in the life discover a problem. Discover a post-traumatic stress disorder, for example. Only 30% of those people need help later on. Normally, our system, our body, our mind is able to come over it, to digest it. When you have as well a good social network, when you have support.
And has the #MeToo movement played a role in your work in the last months?
Maybe it gives me more the courage to say what we focus on. Not in another way. I think it encourages the world because the mask can as well stand for the facade. It can be the addiction that you take away or the trauma. It can as well be, look what happens beyond or behind the facades in our society.
And how do you think society and the world is changing? Can you imagine that the world would be different 10 years from now and the types of clients that you would get would be different, have different problems?
So what we know since the last 20 years is that mental illness is increasing. Yeah? We have stress, we have chronic stress, and out of my experience, we can bring everything down on chronic stress at the end. Trauma is as well a chronic stress.
How do we get rid of chronic stress? It sounds horrible.
It sounds. And when we look in the business life, yeah, in the industry, where people are only a number and exchanged very fast, it's hard. It's very hard. We live in hard time. We live with threatening about the world politics, what happens worldwide. So I think we are in quite difficult times.
And you can't see that changing anytime soon?
No.
I guess that keeps you in your work.
That keeps me in my work, and I think it can help people to focus on themselves and on their well-being to deal better with all the reality we are surrounded. This is possible.
And Claudia, if you had one therapy as a recommendation just for general well-being, perhaps a person is not in such a severe situation, they need the course for 4 weeks, but they just want to do something to feel well. Would you say acupuncture? Would you say massage? What would be a thing?
No, so I'm a psychiatrist, so first I would focus on the mental problem. And then I would say you need a professional help, a psychologist, a psychiatrist, choose a technique that is quite new or modern, which is in a short time, and which reaches the unconscious memory. And then you have yet won a lot. Finding interests, hobbies, resources you can do without a psychologist or a psychiatrist.
Claudia, thank you very much. It's been a pleasure talking to you.
Thank you so much.